In this procedure, you will learn how to orient new patients to your practice, its providers, staff, and office policies and procedures. For new and prospective patients, offer a brief summary. Be sure to cover appointment scheduling and any important policies and procedures. Listen actively so you can respond to the patient's needs. Offer to clarify anything that's unclear. Watch and listen for evidence that the patient understands.
Good morning. Welcome to St. Peter's Family Health. What can I do for you today?
Hi, I just transferred here for my job and I'm looking for a primary care provider.
Great. Well, yeah, I'm so glad you came in and I can definitely give you some information about our practice. So here is our brochure and it's got all of the information about our practice. So on this page, you'll find our contact information and our hours. Here you'll find information about our providers and their credentials. And then here's our motto, which is keeping families healthy. And then right here is just more information about our policies and procedures. So I can go ahead and give that to you.
Thank you. Great. How long would it take for me to get an appointment if I called tomorrow morning?
So we keep a few appointments open every day for emergencies, but for normal checkups, we're scheduling about 2 weeks out. So did you have any more questions?
Yes, I have Priority 1 insurance. Do you accept that?
So we accept most insurance providers, but let me check in the system just to make sure that we're a preferred provider for that company. And is that the First Plus program?
Yes.
Okay. So let's see. And yes, it looks like we are a preferred provider for that.
Great. Do you know what my copay would be for a normal visit?
Yeah, I can check that. So it looks like for a normal visit, that would be $25.
Okay.
So if you've got your ID on you and your insurance card, I can go ahead and get that set up in the system before you make your first appointment.
Okay.
Okay,
Great.
Most offices provide a brochure that patients can keep and use for reference. Your office brochure should cover the following points: a description of the practice, such as the provider's specialties and the mission statement of the practice, your address and a map or directions, telephone and fax numbers, email address and website addresses. If you have a patient portal, give that information too. Staff names and qualifications, a list of services, your hours of operation, appointment scheduling information, policies and procedures for payment, cancellation, refills, and after-hours assistance.